Well, I think if I get a seasonal affective disorder, a person that comes in and gives me the exact history of depression, the same symptoms that I've mentioned before: hopeless, helpless, worthless, weight loss or gain, sleep excessively or not enough, and often suicidal ideas. If that happens to come once a year, or if it comes 3 times a year, if it comes once in 5 years, I treat them the same. I treat them with antidepressant drugs, and I also refer them to my nurse practitioner who does psychotherapy, or the psychologist in our center down in New York that provide that type of extra treatment for the patient. But I myself render the antidepressants. And I will boost it up for the first week. We'll start with a small dosage. I'll boost it up to double the dose the second week if they're still depressed. If they're getting a little better, I may still, the third week I boost it up. But by the fourth or fifth week, 60–80% of these people are almost back to their normal selves. And that's the truth. That's the way all depressives that I see at the Depression Center, the response of these people that have clear biological depression, they also have the history in their family of depression or manic depression. And a lot of these people they all have to be examined at the time of the consultation for whether they have bipolar, because the depressive phase of bipolar looks exactly like the depressive phase of plain clinical depression. If they're bipolar, then you don't treat them the same way. But the plain depressions, clinical depression or seasonal depression, you treat with an antidepressant drug and refer them in the same office to the psychologist or therapist. But there's a high percentage that get well in 2, 3, 4 weeks.